Hello, everyone, and welcome back to Pima Voices. My name is Savannah, and I'll be your host. Today, I am speaking with Don Martin, who is Dean of the Center of Excellence in Health Professions at Pima Community College. And today, we'll be talking about how that Center of Excellence is going to keep Tucson thriving. Hi, Don. How are you?
I'm good. Thank you. How are you?
I'm good. Thank you so much for joining us in the studio today. And I wanted to have you in because you have a very exciting event coming up. So you're going to be doing the ribbon cutting for the new buildings for the Centers of Excellence in Health Professions. How excited are you about that?
We're actually really excited because it means a new chapter in how we do health instruction, health science instruction in Pima and Tucson. And it's just a great new opportunity for us to create 21st century education in health science.
Yeah, I'm super excited for the building. It looks so pretty from the outside, and I'm all like, I missed the tour. So our office did a tour, and like an earlier on tour of like the building. It's obviously a little bit still under construction, but I was looking at the pictures, and I was like, oh my gosh, this building is going to be so pretty. Not just pretty, but it's going to be like state of the art. And so what are some of the exciting new things that are going to be brought into this new building, and what's going to be available for students now that maybe wasn't before?
Oh, wow. I could go on all day about that. It's really completely different from what we've done in the past as far as technology and equipment. Mm-hmm. It's been some time since Pima College has actually had the opportunity to invest in new equipment because this project's been in the planning for a while. And so all that was put on the back burner. And so nearly every space has new equipment. Well, every space has new equipment, but nearly every space has all new equipment. And so where things were getting a little bit out of date as it relates to the workforce, we're actually on the cutting edge of the workforce equipment now. So we've got all new operating rooms. We've got 3 operating room suites that look just like an operating room at the hospital.
Wow.
We've got a pulmonary lab that looks like an ICU at the hospital. Our med lab is state of the art with multiple analyzers that we haven't had in the past. But besides that, it's really a welcoming space that we haven't had in the past. We've been located in a number of different buildings, even on 2 different campuses. We're able now to bring everybody together in one place and offer spaces for students that we haven't had in the past. So we've got student commons areas where they can actually sit and relax and work together, study. We've never had that for our students. We've got a student lounge area that we've never had before. We've got an administrative suite now that's completely open. There are no offices. So all of the staff and faculty share space, and it's a large collaborative space. It's just completely different from what we've done.
Well, it sounds super exciting, and I realized I got way too excited to talk about the building, and I was like, wait, what is encompassed in the Center of Excellence? So I can think of like nursing, radiology probably, like what else? Because maybe people who aren't like knowledgeable or maybe informed about what is encompassed in that Center of Excellence. So can you tell us a little bit about the programs and certificates offered within that?
Sure. We offer 17 different associate degrees and certificates. And they range from certified nurse assistant, which is a 6-week program, up to 2-year programs like RN, radiology, respiratory care, surgical technology. If I try to name all of them, I'm going to forget some, and then I'll be in trouble.
That's okay.
But I'll give you kind of an overview.
Just some, yeah.
But we have all kinds of options for people. You can work directly with patients, or you can work in a healthcare setting where there are no patients. Some people don't really like patient contact. So you can work in a medical lab and not have any patient contact. Some people like different types of patient contact. So you can work in clinical research coordinator and have a more intimate contact with the patient where you actually discuss what's going on with them, that kind of thing. And then everything in between.
Okay, yeah, that sounds like a lot. I know I've had friends who've like done the CNA program and stuff through Pima, and they really liked it. I'm sure they're thinking back like, dang, I wish I was going to school now to like be in this new building. And so how do you think that this new building and facility and more hands-on training and like more of that latest medical technology is going to impact student learning overall?
I think it's just going to make it better. Mm-hmm. I don't know that we say it makes it better because our students really are coming out fully prepared, but it gives us the opportunity to expand that access to other people that we haven't been able to give to in the past. And it gives us an opportunity to reinforce some things that we haven't done in the past. We want to start doing some more interprofessional education where we bring different programs together to work together in a scenario. And so they're working like they would be in the real world. Nurses don't work in isolation. Rad techs don't work in isolation. They work together. When they come to our programs, they typically don't get that kind of experience. And so we're looking to give them that experience now and basically elevate the 21st century skills that we haven't been as good at the past.
So almost like giving them that real world experience that they're going to experience directly into the workforce.
Yeah.
Yeah. Okay.
One of our goals with the new labs that we built is for the students to actually have a more real life experience in the lab before they go to the clinical site. And when they do that, they get to the clinical site, it's more familiar for them, and they have less fear of it, and they're able to concentrate more on what they're trying to learn.
I love that. And so, what do you think is going to be like the most, what do you think is the most exciting thing about the new space that you have for students?
Oh, I have to pick one?
Oh, share 2 or 3. Like, let's hear it all.
Well, I think if you ask the group would say the most exciting thing about it is the new simulation center, which is on the 3rd floor of the H building. We have 9 simulations bays, which can be used in multiple ways. We can use them as a delivery room. We can use them as an ICU and so on. But we also have an anatomy lab there that we have an anatomage table, ANATOMAGE, anatomage. It's a 3D anatomy table, and there are 4 cadavers represented in it. And the great thing about it is not only is it 3D, but you can actually isolate different systems and have the nervous system hanging in front of you, completely isolated from the rest of the body, or the circulatory system, and actually watch the circulation occur. We have in that same room a platform called Syndaver, which is a synthetic cadaver. And it looks like a real cadaver, but it's made out of synthetic materials. You can do anything to it. You can operate on it. You can break a bone and do an x-ray. Yeah, it's just...
Oh, my gosh.
So our anatomy lab is just incredible.
That sounds so cool. I'm like, do I need to go and take some classes?
Oh, you can just come look at it.
Yeah, I'm like, super excited. That sounds really cool. And so you said, so how many floors is this building going to have? Is it 3?
It's actually 2 buildings, and it's 4 floors each. So we've got 8 floors. It's about 85,000 square feet total.
Oh, wow. That's huge.
Yeah.
And so your simulation ones, you said you can do birthing, you can do what else?
So our simulations mannequins, we have high fidelity mannequins, and that means it's the type of mannequins that actually respond to different stimuli. So we can inject medications and the pulse rate will go up. We can tweak it on the computer. So we have our instructors are sitting in a room separate from where the mannequins are, where the student's practicing, and they're actually manipulating the mannequins on a computer. So they can actually make it breathe faster or make it have ragged breath, things like that. But the eyes on the mannequins will follow you in the room, too. It's kind of weird sometimes. Yeah. So it gets about as real as you can get without actually having a live patient in front of you. And so then one of the things we do with that is we bring in actors to play family members. Because one of the things that's really hard to replicate in an instructional situation is all that stuff that goes on around the patient. The family members are crying and they're upset and they're angry, and so we get actors to actually do those parts. Wow.
Yeah. I mean, this sounds amazing. Like, I'm honestly super excited for it. And I always say this, like, anytime like a program gets I don't know, refurbished might be the right word or something, but I'm always like, oh my gosh, this sounds so cool and so exciting. Like, it's almost like not that school's never been fun, but it makes school like so much more exciting and so much more involved. And then, like you said, it has that whole preparing the student like just so much better for real world experience. And does this also mean like with this like facility and buildings that you guys are going to also be able to take in more students as well?
Yeah. So our plan over the next 5 years is to double our capacity. Currently, we graduate about 800 students a year out of the health sciences or the health professions. And we want to take that to about 1,600.
Oh, wow.
So,
and do you think that's going to help meet the demand that like the state needs for nursing and other careers within the health professions as well?
Yeah, it'll help. It's going to take a lot more than that to actually catch up. We've been doing the same thing for 40 years to try to catch up with the normal workforce, right? But when the boomers started retiring, that elevated that curve. We kept doing the same thing, so we were falling further behind. And then the Great Resignation after COVID just really put a hammer on the workforce, right? And so we've fallen so far behind the workforce at this point that we could probably triple or quadruple our capacity and still not catch up.
Wow, that's insane. That's actually like a really crazy like thing to think about.
Yeah.
I'm like, whoa. But at the foundation, we have a new like partnership with Arizona Complete Health, and we know like they were able to really be a big support of your guys' program and needs. And so, are you guys looking to connect with other industry partners as well?
Absolutely. Anybody out there that wants to help out, they're more than welcome to come. We're looking for equipment manufacturers that may want to actually put their equipment in our building to put their name on it so the students will practice on that. And once they graduate, they'll go out to the workforce and say, when I was in school, we used this autoclave or we used this ventilator or whatever it is, right? And they bring that experience with them to the workforce. And that becomes part of the decision-making process of the industry then when they start to replace ventilators and autoclaves and those types of things. That's a great opportunity for industry partners, right? Other individuals, we have people donate to scholarships, specific scholarships. Maybe they have a loved one that was a nurse and they passed away and they want to memorialize them that way. So there's a lot of opportunities for people to be a part of this, whether they're directly a part of it in instruction or they're mentoring students or they're donating to the foundation for different support things.
Yeah, and they can always contact you for that information. They can go through us or the foundation to learn more on how to do that. And so, speaking of like students and like alumni, do you have a specific story or anything that's resonated with you of a student who has gone through the program and has like really excelled within their career?
Yeah, actually. So she didn't know I was going to do this, but our Associate Dean of Nursing, Yolanda McCoy-Stokes, is a Pima graduate. She graduated from the RN program many years ago. Worked in the hospital, worked her way up, has gone back to school and advanced her degrees, and she's our associate dean now. It's kind of an extraordinary path. Most people that go into healthcare and they finish their careers in healthcare, a select few want to do more. They want to do something different, right? And Yolanda's made that choice to actually be something different and to really work at expanding the workforce and giving people opportunities. And that's really her passion, right? Is giving people opportunities to be a nurse.
Yeah, I love that. I haven't met Yolanda, but I'm sure I'm going to have to now meet her at the ribbon cutting. And I've noticed too, like a lot of people who have like a connection to Pima, like they always find a way to like come back and help. And so that's like really lovely that you have that person who's kind of been through the ropes, knows what it's like here, but can also see the evolution of the program as well and just see how it's growing and how it's, advancing to help students in need and into the workforce. And so I know you have this like new awesome building, 2 of them, but what would you say is maybe some other goals that you have for the future of the Health Professions Center of Excellence?
Yeah, we have dreams of creating a number of new programs. And I say dreams, they're really plans is what they are. And we're looking at creating some programs that are not the traditional health science pathway, health science track with, hands-on, that kind of thing. More along the lines of the general education pattern. Programs like public health. There's a group out of Scottsdale called the League for Innovation, and they've created, along with the public health profession and their professional organization, an associate degree in public health that will articulate to a bachelor's degree in public health and so on. And we've started that already. We've created a community health worker program that actually will feed into that program in multiple steps. And so we really want to focus on guided pathways and programs where students can come in and get a credential. And if they have to leave, they can go to work and then come back later and start in the same place and keep going up.
Oh, that would be really good. I like that. And so, do you think that there's anything else like that the public should know about health professions, or maybe a student who's interested and wants to learn more? Like, what would you say to those people?
Well, so the thing I like to tell people anytime I do anything at all, any kind of speech or presentation or anything, is that I like people to understand what kind of impact we really actually have on the community. And so if we graduate 800 students a year and each of those graduates goes out and sees 5 patients a day, that's 4,000 patients a day they see.
Oh my goodness, yeah.
20,000 patients a week.
Wow.
And over the course of a 52-week year, that's 1,040,000 people.
Oh
now,
my gosh.
Pima County is only 1 million people, which means we literally touch the lives of every single person in Pima County. That's one cohort. We do that every year. And so if you come here and you become part of the health professions, you get a chance to be part of that.
Oh my gosh, that was like so beautiful. That was like, yeah, that's really touching. You don't think about it in perspective like that sometimes. You think like, I'm just here to start my career, get this job, work in a hospital, I'm working in a clinic. When you put in words like that has like a whole new meaning behind it. And that's like a really beautiful way to put that. I really like that.
Yeah,
I think that's a really beautiful message.
Yeah, and when we talk about changing lives, we're not just talking about changing the lives of the patients and the community and their families. We're talking about changing the lives of the people who come to the program.
Yeah.
Many people that come to our programs, they've worked in very difficult jobs and very low wage, and those jobs are not stable. Mm-hmm. The health professionals' jobs are very stable. They pay well. They have lots of opportunities to do other things. And so we change lives on multiple levels, and we have a real impact across the community.
And some might say it's keeping Tucson thriving.
Yeah, there you go.
I love all this information. And like, even if like tying it back to like industry and things like that, if someone wanted to take a tour of the facility, that's also an option too, right? To get to learn more, see what you guys have within your spaces. And so you're more than open to that option as well, right?
Yeah. So we've got, I think, 4 tours this week alone.
Oh, wow.
And we did a couple of tours. We didn't do any tours last week because it was a short week, but just before Christmas did a couple of tours. If anybody has a desire to see the facility or they have a reason to see the facilities, they want to know how they can participate and seeing the place might help, and come on. We're more than happy to show it off.
Well, I'm super excited to have both of these buildings open to the students, industries to come see it. I'm excited to see how these students, I don't know if accept is the right word, but just like engage with it and just learn. I think it's going to be really, really amazing. Like, I'm super excited. The healthcare industry to me is like super scary and I don't really like it. I'm always like, ooh, but I think this just brings a whole new level of like expertise and just engagement. And I think it's going to be amazing. For lack of a better word, amazing. So I'm really excited for your program and everyone who's involved with it. I'm sure this has just like been a tremendous journey to even get here. And I'm sure it's going to continue to propel into amazing things. Yeah. And did you have anything else that you wanted to share at all today with the community?
Just that's why we're here, right? Is the community. Without the community, there's not any point. Without healthcare, life is very different for all of us. Yeah. And our purpose is here to serve this community, but also to be a part of it, right? And that's why we built this Center of Excellence. This is a community project. This is not a Pima Community College project. This is not a health professions project. This is a community project. It's Tucson and Pima County. And without the support that we get from the county, and the city and the extended area, including Santa Cruz County, we couldn't do this, right? And so this is their space too.
Well, I really appreciate you even bringing that up as well, because sometimes we may think about like, oh, it's just for students, it's for that. But like you've mentioned, the healthcare industry is so much more than it goes past the students and the learning here at Pima. It is the community. And so I think that message is super important as well. And maybe isn't heard as much, as it should be. And so I think you put it in really wonderful terms today. And I'm glad I heard that, because it's a little bit reminder like how important the healthcare industry is and how important this is going to be for everyone, not just for students. Yeah. And so again, I really, truly appreciate your time today. I can't wait for the ribbon cutting because I haven't been inside the building or both of them. And I'm really excited to see everything that's coming to fruition. And if anyone wants to take a tour of the facility, they can contact you. They can contact us at the foundation. We'd be more than happy to share that information and get that going for you. And so thank you again for coming by. I've learned so much, and I'm super excited for it. And so I hope everyone else is just as excited as we are. So thank you.
And thank you for having me. I appreciate the opportunity.
Yeah, thank you. And I will see everyone else next week on a new episode of Pima Voices. So I will see you then.